per day. Joining me now to discuss what's driving this latest surge, family medical physician, Dr. Adrian Burrowes. Welcome to the show, Dr. Burrowes. How's it going?
Thank you. Thanks for having me.
Yeah, tough time, I would imagine, for medical professionals. So we want to start by asking you, we thought, right, we'd be having a normal holiday, but we're looking at cancellations just left and right with cases surging. This is a broad question, but how did we even get here? What is driving this increase in cases?
What's driving the increase in cases is manyfold. One is I live in Florida. If you go outside and go to any store, the majority of the population is not wearing a mask. So we have COVID fatigue driving it. Two, we're having a lot of large gatherings. We just came through Thanksgiving and Christmas. We're about to have New Year. So we're having a lot of people gather together in tight spaces. We have a lot of the population still unvaccinated. And so when you take all those things together with a very, very transmissible variant currently in the country, in Omicron, and still we're dealing with a Delta, which is a much more aggressive variant. This is what's leading to what we're seeing now.
All right, so a combination of a lot of different things, it seems like. We know that the CDC has now shortened the timeline for isolation if you test positive. So it was 10 days. Now they have reduced that to 5 days. And we have some sound from the director that we want to go ahead and listen to really quickly.
Our guidance was conservative before. It has said 10 days of isolation, but in the context of the fact that we were going to have so many more cases, many of those would be asymptomatic or mildly symptomatic. People would feel well enough to be at work. They would not necessarily tolerate being home, and that they may not comply with being home. This was the moment that we needed to make that decision and those changes.
So the CDC facing some backlash by some over those recommendations. We want to get your response to the shortened quarantine time.
Yeah, so I mean, they're doing this for basically financial reasons, right? They're worried about the loss of workforce over the public health concern. So the public health concern is the same. So I want the public to understand that. The public health risk is the same now as it was when the pandemic started. The reason why they are changing the guideline is because the majority of people who have the Omicron version of coronavirus tend to be either very, very mild, where they get the sniffles, or like, a runny nose, things like that. Or they're totally asymptomatic. And so they're trying to find the best way to educate the public that is probably not going to want to stay home with those types of symptoms, how to come back into society without spreading the disease. So they're telling you to take 5 days, where the average person is really infectious after the first 2 or 3 days of symptoms. So they're thinking that 5 days will probably be sufficient, and then telling you for an additional 5 days after that to make sure you wear a mask everywhere you go that's really a firm fitting mask. But your infectivity, the risks are still there.
Okay, and it seems, and correct me if I'm wrong, but it seems like it also might depend on the variant that you have, or does that have anything to do with how transmissible you are after a certain point?
Right. So why I think that this is a problem for the CDC is because most people are not going to know what variant they have. Unless you're admitted to the hospital, you're not going to know if you have Omicron or Delta or some new variant or some prior variant. And so these instructions are really being based on Omicron. And so God forbid you have a different variant, your infectivity might be different. And so that's why I'm a little concerned about these recommendations. I understand why they did that, but I do think that everyone needs to remain vigilant. Wear a mask everywhere you go. That's my recommendation, and try to get vaccinated if you can.
Right. We also want to talk briefly about hospitals. You're obviously a medical professional. How is this new surge in cases really impacting healthcare workers?
It's completely devastating our supplies. We have had issues with supply chains. In other words, trying to obtain masks, trying to obtain gloves, trying to obtain gowns. And we had a little bit of a break just before Thanksgiving, where we were able to try to replenish some of those supplies, and we've exhausted all of those already. We have had a huge surge in pediatric cases as well, and getting supplies for pediatric patients is a lot more difficult than for adults. And so this is very, very concerning. On top of that, we're having a rise in flu cases as well, which is a forgotten disease, and so it's really stressing the medical environment.
Wow. And then you have medical professionals who are also getting sick too and have to take time off of work. So it's just a mess all around. All right, Dr. Adrian Burrowes, we appreciate your time and your insight. Happy New Year to you.